Physiotherapy is a combination of science and art. Eugene believes physiotherapists need to equip themselves with medical knowledge and clear clinical reasoning skills. At the same time, they require a good sense of feel in their hands and keen observation skills to facilitate problem identification and therapy. This has motivated him to continue to practice and improve his manual therapy skills to help more people dealing with pain. Eugene graduated from Marshall University. Since graduating, his main focus is in the field of musculoskeletal physiotherapy. He obtained a certified spinal manual therapy certificate from Australia. Patient recovery is always his biggest motivation to continue to practice as a physiotherapist. Mr. Eugene, over to you.
Okay, good afternoon to everyone. So let me share the screen first. Okay, so today I'm going to talk a little bit about this importance of consistency in physiotherapy after the stroke. So before we know, we're going to know about the importance, right? We have to know what physiotherapy actually did. Okay, so what actually physiotherapy did for stroke rehabilitation is that actually we were doing something like a targeting on the principle of neuroplasticity after the stroke, because after the stroke, right, the neuroplasticity will occur and then the relearning process will come in. So over there will be designed treatment based on the principle which the brain is capable of reorganize and also adaptation after the injury. So according to their own condition, different people will be design a different kind of treatment to them. But for physiotherapy, what we focus more on is about more movement, okay, mobility, instead of like covering a large portion like emotional or cognitive, but we will be focused more onto this mobility. Okay, and then the treatment will be focused more onto the functional and also task oriented. Okay, why? Because after all, when the stroke patient already recovered in the later stage of in future, right? Okay, they have to go back to their home, okay, and started to do their things independently. So training their functional and also task oriented things is very essential. All right, so over here, there's a very simple formula for you to have a very successful recovery, which consists of repetition and also consistency. What means by this repetition is that because after the stroke, right, okay, our brain, okay, because there's a damage into our brain, so we will be missing out on losing out some of the memory of our movement. So we can't really do the movement after the stroke. Okay, so with this repetition of the movement that physiotherapy taught you, okay, so it can actually help to create a new neural connection in your brain, which means that we will create a new movement pattern, okay, so that because previously you already been missing out on lose the movement, right? Okay, so now it's time for you to create a new one for yourself. Okay, however, okay, after we create a new neural connection, how are we going to make it into perfect? Okay, consistency is the one to make the movement into perfect. Okay, so consistency will reinforce and also strengthen those connections. Okay, by means over here, the consistency and the repetition, the differences is that consistency meaning that we have to do the exercise or the treatment given by the rehab team, okay, and make it into a daily routine, okay, but we do not want you to do the treatment, the exercise like after 5 days only you do once, so the treatment effectiveness will be not that good. Okay, so we wanted it to be a daily routine so that the consistency can actually strengthen and also make the movement to become perfect. Okay, so why physiotherapy stroke rehabilitation is so important for stroke patient? Okay, because for stroke rehabilitation, it's not like a 2 to 3 weeks time and then you are able to fully recover. It's a long period of time. So physiotherapy rehabilitation is a long-term support for the stroke patient, and it is really important that the patient have to start since the acute stage of the stroke. acute stage of the stroke over here means that when the time that you are still in the hospital, okay, once your vital sign is stable, all right, within the 3 to 7 days after you get stroke, then you should actually start to do and receive the physiotherapy treatment. Okay, so when you started earlier, right, because of the neurospasticity, once the brain damage, okay, neurospasticity will occur and will start. Okay, so this is the period of time that we actually have one of the golden rehab golden period of rehab time for stroke patient, which is 6 month time. Okay, so if let's say you started earlier, so during this golden period of time, right, the relearning process will be more active, so it's more easier for you to relearn back the things that you have been losing after the stroke. And at the same time, we will be adding in some of the balance training or coordination training, because in the future we wanted our patient to be independent as possible. So a lot of others training that we will be included in, okay, like balance exercise, coordination, or even like walking in a proper way. Okay, so this is all the things that we concern in. And one more thing, what is the most important during the acute stage is that when we're trying to do the mobility exercise, right, we have to make sure that the mobility is in a proper way. Because if let's say you're just trying to do some of the mobility with some compensated movement, like when you're trying to lift up your hand, you are also using some of your muscle, like your shoulder is lifting up or your body is actually tilted to the side. So all this in the long run, like, okay, it will cause some complication. Okay, so those complications might be spasticity, which which means that our muscle will become very tight in the time, and then at that time we are very hard to break it down. So we have to start the treatment in the acute stage itself. Okay, so over here, I actually divided out into 3 stages for stroke rehabilitation. For the acute stroke rehabilitation, within the 3 days to 7 days after the stroke, right? Okay, the most concerned things that we wanted to deliver to the patient is about the education. Okay, we have to let the patient know about the process of recovery after the stroke, and then the way how to deal with the stroke and to improve their functional. So most of the time, okay, what we will focus more is onto their lung, because after the stroke, they will be laying down at the hospital for almost a week time, 3 to 1 week time. So we will be training their lung, and at the same time, we will try to improve their bed mobility. Okay, so that once they're going back to their home, it's more easier for them to roll from the bed and then sit up from by themselves if possible. And last but not least, also we will try to educate them how to do a transfer technique, like from a bed to a wheelchair to a chair, or even going into the car. So it's more easier for them to come for a medical follow-up later on. So this is the things that we normally focus during this acute stroke rehabilitation in the hospital. Okay, so after discharge from the hospital, we comes to the stroke rehabilitation, which around like half a year to a year time or even longer. Okay, so over this time, right, we will be focused a lot onto the mobility, because we know that as a physiotherapy, what we aim for the stroke patient is about whether their mobility is in a proper way, and then to make them into a more independence. Okay, so mobility is very important. We will be teaching them in a proper way. Okay, and at the same time, because we want them to be more independent, we will be teaching them some of the balance exercise, and also add in a lot of functional activities things, all right, to train up, like maybe asking them to hold a cup of water and then drink, or even like combing their hair or dressing up themselves. Okay, so a lot of movement for them to train up. And at the same time, we will also treat them according to their condition, because for stroke patient, every patient have different kind of condition as well. So we will treat them accordingly. Okay, then after that, we will be going to the later stage of stroke. Over here, right, for later stage of stroke, which means that the patient is already, okay, 2 types of patient most of the time, is that the patient already achieved the highest level of functional that they can achieve, or the people that already hit their plateau in their recovery. Okay, so in this stage, right, okay, most likely is around after 1 year's time. Okay, so what we focus more is not going to be like improving, asking them to improve or doing exercise to improve their functional, but instead of that, we are more on maintaining onto their functional level, and at the same time, we will ask them to come back to for follow-up after maybe like 3 to 4 months time to monitor their functional level, whether is it their functional level is maintained, or if let's say the functional level is reduced, we will be prescribing a specific exercises for them to improve back their functional level. So this is the 3 stage of stroke rehabilitation from physiotherapy. The first is acute stage, then normal, subacute, and also later on going to the later stage of stroke rehabilitation. Okay, so for a summary, okay, how to achieve successful rehabilitation or recovery is that you have to commit into the exercise or even the things that the rehab team asking you to do, and you have to consistently doing it. Okay, so that's all from my side, and I will be passing back to Tracy. Thank you.
Thank you very much, Mr. Eugene, for letting us know how physiotherapy contributes to the recovery of stroke patients after they've been affected by a stroke. Right, I have a couple of questions for you. Do we need expensive machines and tools for recovery at home?
Okay, so for this one, right, we did not deny that an expensive device is not useful. It's actually useful, but as from the perspective of physiotherapy, what we wanted is that we wanted to improve their functional level, okay, and try to make them to get used to their environment at home. So I think that exercise or rehab or physiotherapy prescribed exercise for them is more than enough, because eventually what they needed to do is that they have to keep practicing onto the movement, and then make the movement to become perfect and getting back into their functional previous functional level as much as they can.
Okay, right. Ideally, how many hours a day of exercises do I need before I can see improvement?
Okay, so I think there's a lot of misconception for those stroke patients. Okay, because they will say, I do a lot of exercise at home. Okay, so over here, okay, you can see most of the time when a stroke patient see a physiotherapist is around, the treatment will be around 45 minutes. And in this 45 minutes, most of the time, a physiotherapy role is to ensure that the movement that they do is correct, and then also we will be prescribed the exercise according to their condition. Okay, so with this 45 minutes is not enough for them to improve in their functional level. Okay, so what they need to do is that they have to constantly doing the exercise that given by the therapist or even by the rehab team. Okay, they have to constantly practicing it, and actually there's a research saying that you have to do each movement you have to do daily. Each movement you have to perform it for at least 300 times to 600 times. Only you are able to really improve or get used to the movement, and to so that your movement can be better.
Okay, so the last one is probably related to intensity. Is it enough if I just do easy, simple exercises at home?
Okay, so for the incentives, intensity wise, so for if let's say a lot of people will say that can I do easy exercise or simple exercise at home? Okay, I would say this exercise would not really give an effectiveness to the stroke patient, because normally when we prescribe a exercise to a patient, we have to according to their condition and then given some specific exercise to them. Okay, so this specific exercise will really benefits them, okay, and target onto their movement. Okay, and the second thing is that because if let's say you think that the exercise is easy for you to do, which means that you already know how to do it and you already able to do it. So there's no use for you to keep practicing the things that you already know how to do. So you have to choose those exercise, okay, that has a little bit challenging for you, so that you can improve your functional level.
All right. Thank you so much, Mr. Eugene. Just to sum up, Intensive specific therapist-guided therapy is a key to recovery, but you have to do your homework at home. It's not just us, correct? And repetition is very important.